study program, like what Gary has mentioned, there will be recording. So please refrain for sharing your personal information during the recording session. Okay, so for today we have a community nurse, Ewan, who will be sharing about today's topic about urinary incontinence. Passing over the mic to you, Ewan.
Okay, thank you, Felicia. Good afternoon, everybody. Good afternoon. All of you can hear me?
Okay.
Okay, nice to meet all of you again. Y'all all eaten your lunch already?
Yes.
Yes. Okay. So let me welcome all of you to today's Health Talk series. And the topic for today is urinary incontinence. My name is Ewan and I'm from SGH Community Nursing. So stay with me throughout the talk. If you have any question, please feel free to write in the chat box, or you can note down first and ask me after the Health Talk. So are you all ready? Okay, so here we start already. So the content for today is what is urinary incontinence, the cause of urinary incontinence, the risk factor of urinary incontinence, the different types of urinary incontinence, the treatment and management plan for it, and lastly, the healthy bladder management. So first, before I start, can I check how many of you actually heard or know of someone who has urinary incontinence? You can share with me by unmuting yourself, or you can write in the chat box also. Anyone would like to share? Have you all heard of urinary incontinence before? No? Okay, never mind. So urinary incontinence. Oh, you heard of it before. Okay. Anyone else heard of it before? Okay, never mind. But hopefully after today's talk, you all will know what is urinary incontinence. So for those who are not sure, urinary incontinence is the uncontrollable leakage of urine at an inconvenient and socially unacceptable moment. So in short, it means the leaking of urine that you can't control. Actually, many men and women in Singapore suffer from urinary incontinence. But for how many people exactly suffer from this, we do not know, because many people do not tell other people about their symptoms. They may feel embarrassed about it, or they may feel that nothing can be done regarding to this issue. So they choose to suffer in silence. So I hope today, right, after the talk, the take-home message for today is urinary incontinence, right, is not just a diagnosis. It can be a symptom of an underlying medical condition. Not only so, people who suffer from urinary incontinence can also affect their emotion, psychological, and social life. So for those, right, who might be experiencing urinary incontinence, I hope you can give you a second thoughts about going to the doctor and discuss about your symptoms and get early treatment for it. Okay, the symptom of urinary incontinence. Many people experience occasional or minor leak of urine. Others may lose small to moderate amount of urine more frequently. So the causes of urinary incontinence, as I mentioned earlier on, right, can be due to underlying medical condition that an individual might be having. So to make things easier for you to understand, are divided into two categories: the temporary cause and the permanent cause of urinary incontinence. So for temporary cause of urinary incontinence, right, is usually caused by an underlying condition. A person will regain back its normal bladder control when the condition causing the temporary urinary incontinence has been identified and resolved. So the three common causes of urinary incontinence are usually the food, drink, or medicine that you're consuming. Certain food, drinks, and medicine, right, can act as diuretic. They will stimulate your bladder and increase the volume of urine. They include alcohol, our everyday coffee, carbonated drinks such as Coke, food that are high in spice and sugar, and acid that can find in citric fruits such as orange or lemon. For individuals who are on heart and blood pressure medicine, may experience temporary urinary incontinence as well. Urinary incontinence can be caused by easily treatable medical condition. What are those? The most common is urinary tract infection. So when you're having urinary tract infection, the infection can actually irritate your bladder, causing you to have the strong urge to urinate every time. And sometimes even before you can reach the toilet, right, you actually already experience leaking of urine. Constipation is one of the common causes, especially in elderly. The rectum is actually located near the bladder, and they actually share many of the same nerves. So hard and compacted stool in the rectum can actually cause this nerve to be overreact and then increase the urinary frequency. Okay, let's move on to the permanent cause of urinary incontinence. There are many causes, and some causes are actually related, especially for men and women. So for easy references, I divided them into the most common cause for women, most common cause for men, and also the most common causes for both women and men. So let's discuss about ladies first. In women, the top 2 common causes for urinary incontinence are menopause and childbirth. So many women actually suffer from urinary incontinence after childbirth, especially for those who actually went through more than one normal vaginal delivery. That is because pregnancy and childbirth can affect the conditioning of our pelvic muscle. They can also stretch and injure the pelvic nerve, causing the pelvic floor muscle to be weakened. That's the reason why incontinence may last for a surprisingly long time after childbirth. In women that reach the menopause period, women tend to produce less estrogen than before. And estrogen is actually a hormone that helps to keep the lining of the bladder and urethra healthy. So deterioration of this tissue, right, can aggravate incontinence as well. In men, the top 2 causes for urinary incontinence are usually prostate problem and bladder damage. So in the prostate, prostate is actually a small gland, right? They actually surround part of the male urethra, and it tends to get enlarged in a certain parts of their life. A tumor or urine stone anywhere along the urinary tract, right, can actually cause the blockage of the urine as well. So surgery can be done in severe cases for men in this situation, but however, incontinence can be part of a post-surgery complication. Okay. So for both men and women, right, the most common causes that will cause urinary incontinence are spinal cord injury, stroke, neurological disease such as Parkinson or dementia, as well as chronic disease such as diabetes. All these diseases can suffer from nerve damage, and it will interfere with the nerve signal involving the bladder control, causing the problem of incontinence to happen. If you do not have any of the mentioned cause for urinary incontinence, that does not mean that you don't have a risk of developing it. So now I will discuss and explain to you all what are the risk factors that will increase the risk of developing urinary incontinence. So first, gender. As I mentioned earlier on, right, women are actually most likely to suffer from incontinence as compared to men because we went through pregnancy, we went through childbirth, as well as menopause period. But however, men who has prostate gland problem are at an increased risk of urge and overflow incontinence. I will discuss about this in the later slide.
Hello, nurse. Would you mind, there is some scribble on the screen, a green line. Can that be removed? Because it makes it does injustice to your slides, really. It's like you present, yes, thank you very much.
Sorry for that. Okay. Okay, so I continue, okay?
Yes, thank you.
Okay, so second risk factor is actually age. So as you grow older, right, the muscle in your bladder and urethra lose some of their strength. So changes with age, right, reduce how much your bladder can actually hold the urine and increase the chance of involuntary urine release. Being overweight increase pressure on your bladder as well as the surrounding muscle. Therefore, it will weaken them and allow urine to leak out whenever you cough or when you sneeze. So many of us actually know that smoking has many negative impact in our health. So one of the negative impact will be increase the risk of urinary incontinence. Last but not least, strong family history. If a close family member of you have urinary incontinence, especially urge incontinence, your risk of developing the condition is higher. But do note that urinary incontinence is not inherited. So it does not mean that if my mother got urinary incontinence, I will sure get it. It will just increase the risk of me getting the similar condition. Okay, now it's time for me to rest for a while and hear your voices. Can anyone here share with me there are how many types of urinary incontinence? Anyone would like to share? Want to make a guess? One type, two type?
Two.
Two types? I hear someone say two. Any more guesses?
Two types, right?
Two types.
Majority of you say two types. Any more guesses? Last guesses? Okay, thank you for all your guesses, but the correct answer is 5 different types of urinary incontinence. And I'll be sharing and discussing with you what are the different types of urinary incontinence. So stress incontinence is the most common type of incontinence relatively in women. If you leak urine during activities such as coughing, laughing, sneezing, or even carry heavy stuff, this is likely caused by stress incontinence. So I give you a little bit of anatomy. Your pelvic muscle, right, is located beneath your bladder. So stress incontinence occurs when your pelvic muscles are not strong enough. They cannot withstand a stress or a pressure pushing onto the bladder. So that's the reason why when you do a certain pressure-giving action such as sneezing or coughing, your pelvic muscle will give way. And as a result, the urine can leak out. Another common type of urinary incontinence is known as the urge incontinence. It's a sudden intense urge to urinate followed by involuntary loss of urine. Some may need to urinate more often, including throughout the night. Urge incontinence is also known as overactive bladder. So in an overactive bladder, the bladder becomes overly sensitive to the stretching and nerve signal. As a result, the muscle of the bladder starts to tense up, causing an urge to urinate even when your bladder is only partially filled out. But do note that urge incontinence can be caused by minor conditions such as urinary tract infection, which will be resolved once the infection is being cleared up. So overflow incontinence is where you will experience frequent or constant dripping of urine due to a bladder that does not empty completely. So with an overflow incontinence, the body actually makes more urine that the bladder can hold, but your bladder don't have the capability to empty it completely, therefore causing it to leak urine. But in addition, right, in some situations, there may be something blocking the flow of the bladder, and the muscle may not have the strength to squeeze it out as before. This type of incontinence is rare in women. It is more common with men who has prostate problem or has a prostate surgery done before. Functional incontinence may be the cause of a physical or mental impairment that lies in the getting to or using the toilet when the needs arise. There are many possible causes of functional incontinence. Often, the cause of the functional incontinence is the problem that keeps the person from moving quickly to the bathroom and removing their clothes to use the toilet, or even transfer from a wheelchair to a toilet. These include problems like backache, arthritis, or neurological problems such as Parkinson's disease as they have shuffling gait. Further compounding the problem, disabled toilets, right, are not easy to get by, especially in the community. In other cases, functional incontinence may result from people with problem or thinking issue. A person with Alzheimer's disease or other form of dementia, for example, cannot have a clear mind to know when they want to use the toilet, how to go to the toilet, or recognize the need to use the toilet. People with severe depression may lose all the desire for self-care, may suffer from functional incontinence as well. Lastly, the last type of urinary incontinence is actually mixed incontinence. In mixed incontinence, right, the symptom includes leaking or a sudden urge to urinate. So mixed incontinence usually combine of stress incontinence and urge incontinence, which is quite common in older female elderly. So complications of urinary incontinence include skin problem. So rashes, skin infection, or sore can develop from constantly wet skin due to the leakage of urine. High fall risk, especially in elderly who experience urge incontinence, will tend to rush to the toilet, right, whenever they feel the urge to pee. And sometimes, right, they will slip and fall down due to the slippery flooring in the toilet or obstruction along the way. Incontinence, right, can also cause your risk of recurrent urinary tract infection. In severe cases, if the infection caused by the urinary tract infection bacteria is not cleared properly, it might lead to kidney infection. And if no proper treatment is done early, your kidney may suffer from acute injury, causing more problems, which might lead to hospitalization. Okay, question time again. Can anyone share with me or make a guess? What are some kinds of emotion that a person who has difficulty controlling their passing of urine might possibly experience? Anybody wants to make a guess? Usually, what kind of emotion they will go through? Anyone want to try? You can unmute yourself and answer me.
Embarrassment.
Embarrassment, good. Anyone else?
Anxiety.
Anxiety, well done. One more guess? Anyone want to make the last guess? Okay.
Stressful.
Stressful, yes. Okay, thank you. Thank you so much for your answer. And yes, experiencing urinary incontinence, right, not only have negative complication on our health, right, it also have negative complication on our psychological side. Elderly, especially who suffer from urinary incontinence, right, will often limit themselves from social activity as simple as family dinner gathering, as they will have lowered self-esteem due to fear and anxiety related to being incontinent in the public. For example, right, they will keep having this thinking that they have this urine smell lingering around them and they will not dare to go near their family member. Most of them will also suffer from sleep deprived as they have to constantly wake up in the middle of the night to pass urine, and some might fear that they will wet the bed, which make them even afraid to sleep deeper in the middle of the night. Depression and anxiety is most common in women with female incontinence. They will actually feel humiliated and refuse to receive help from others, including their loved one. They will start to withdraw themselves away from others and avoid doing things that they like to do previously. They will usually become more sensitive and making them to have more mood swing episodes. Okay, this will be the last question. So my question to you all is, if you all have difficulty with urine control, will you all see a doctor about it? How many of you will actually see a doctor regarding to this? Anyone?
I will.
You will? Very good. Anyone else? Anyone?
Observe for a season first to see whether
observe
it
first.
is frequent or is it stress related.
Yeah.
Okay.
Depending on how serious it is.
Okay, so from the sharing, I can see that most of you are actually quite open up to see a doctor for urinary incontinence symptoms, right? Okay, so thank you once again for the final sharing. So many people, right, actually thinks that urinary incontinence is part of getting old. But let me reassure you in this talk that this is not part and parcel of growing old. Urinary incontinence can be prevented, managed, or even treated if it is origin from a treatable disease. So usually when you first see a doctor, the doctors will usually take a careful and complete medical history from you. They will ask a series of questions to find out more from you. Question includes like, are there any underlying disease or medicine that you might be taking that actually can contribute to the incontinence? Are there symptoms present at night? Are there any environmental factor that may be contributing to this? How much water do you drink a day and what kind of drink that you usually will drink? Is there any recent change in bowel movement? For example, are you currently suffering from constipation? Other component that the doctor will actually assess is your age, your childbirth history, and also your medical status, whether or not are you suffering from any chronic disease such as diabetes. Doctor will also perform a full physical examination to determine if you have any prolapsed uterus or signs of constipation. A neurological examination may be done as well. This can help to find out the cause of a urinary incontinence. The doctor will usually ask for a routine urine test to check for any urinary tract infection. You may also be asked to do a test to see whether you can empty your bladder completely. You'll be asked to urinate to empty your bladder fully. Then the amount of urine left in your bladder will be measured immediately right after you pass urine by an ultrasound machine called the bladder scan machine. Your doctor may also ask you to keep avoiding diarrhea for 1 to 3 days to determine the number of episodes of leaking that you face per day before determining what kind of stress, what kind of incontinence that you may be facing. So the treatment for urinary incontinence consists of behavior therapy, drug therapy, surgery, medical device such as vaginal ring preserving. So usually, right, doctors will usually recommend.
Can you go back to the last slide because it just went through. Yeah.
Okay. So okay, I'll move on now. Okay, so in most of the time, the doctors will actually recommend for the safest non-pharmacological way to treat your urinary incontinence first. So usually this is what we call by behavioral therapy. And behavioral therapy actually includes bladder training, double voiding, lifestyle changing, and pelvic floor muscle training. So for bladder training, right, urge incontinence can be improved by bladder retraining. The goal is to help your bladder to become less sensitive to the things that will trigger its tendency to squeeze down and create a tremendous urge to urine. So to achieve this, right, you need to empty your bladder on a regenerate schedule before it becomes full. You may need to urinate every half an hour or an hour in the beginning. Gradually, lengthen the interval between each of your toilet visits. So by then, right, your bladder should show improvement by not responding as urgent as before after several weeks of retraining. There are several approaches in improving your bladder emptiness. Double voiding is one of the most common. So this technique is especially useful for people who feel like their bladder is not empty or has a tendency to return quickly back to the toilet after voiding, maybe say 20 minutes before. So these are the 5 steps you can do during double voiding. Step 1, lean yourself a bit forward while comfortably seated on the toilet seat. So step 2, bilateral hand must be placed on the thigh or knee. Step 3, ensure that your bladder is then empty to the maximum extent. This means that try to squeeze out as much urine as you can during the first urination. Step 4, do not immediately stand up and leave the toilet. You can sit on the toilet seat and wait for 20 to 30 seconds again before proceeding on to the second urination. Step 5, lean yourself a bit further, attempt to pass urine again. So this is what we mean by double voiding. Lifestyle changes is very critical in managing urinary incontinence as well. If you are overweight or obese, consider losing some weight. This will help you to have fewer episodes of stress incontinence leak due to the pressure in your bladder. Doing exercise is good, but doing the right exercise is essential in managing urinary incontinence. High impact exercise such as sit-up will direct all the pressure to your pelvic muscle. Such exercise, right, will strain your already under stress pelvic muscle. So for the best interest, right, to avoid all the high impact exercise. So you can consider exercise with low impact such as brisk walking, cycling, or even swimming. Avoid lifting as well, as it may cause a similar effect on your bladder. Avoid alcohol, quit smoking. So this is no surprise considering that alcohol, right, is one of the main reasons for many health-related problems. So alcohol can actually increase the acid level in your body. That's why it will lead to urinary incontinence to occur. So just like alcohol, smoking also comes with many negative health disease and complications for our body. And it can be avoided by quitting smoking. So smoking has side effect on your urination. It not only bother your bladder to cause more excessive and uncontrollable urine, it can also cause the coughing spasm, which will make you leak urine along the way. Have an alkaline-rich diet. So what is alkaline-rich diet? The foundation of alkaline-rich diet consists of green and colorful fruits and vegetables. And guess what? Alkaline food, right, actually has the ability to cleanse your urinary system. So it will be a huge bonus if you're experiencing urinary incontinence. Eat more fiber and drink more water. While it's easy to assume that drinking more fluids will make urinary incontinence worse, right? Because you might think, the more water I drink, the more I will go toilet to pee, correct? But limit yourself from not drinking enough water can cause more problems as it strains your bladder capacity and cause issues such as constipation. So make sure that you drink enough water so that you avoid complications like constipation, which will irrigate the urinary incontinence. Okay, so many men and women, right, can improve or eliminate their urinary incontinence by doing pelvic floor muscle exercise. They aim to strengthen the muscle that surround the opening of the urethra, vagina, and even rectum. So for the next slides, right, I will actually showing you 2 different videos that focus on the pelvic floor muscle on women and also another video on men. So please enjoy the video, okay? Maybe how do I? Yeah.
And let's do Kegels. Okay, this is a fun exercise. You're not going to be able to see anything, so even though I'm squeezing my hand, what I'm really doing is working my pelvic floor. Now to work this muscle, you have to pretend like you're going to the bathroom and you're stopping the flow of urination. So right now what I want you to do is now contract the pelvic floor, stop the flow of urination, and then release it. And again, contract and release. Now this time I want you to think that you're on an elevator and you're contracting, and now you're going first floor, second floor, third floor, fourth floor. Hold it there, really contracting, at the same time releasing the hip flexors and releasing the buttocks, and now lower the elevator back down again. Remember what we're doing right now. Let's go up the elevator.
Sorry, we cannot hear at all.
Second floor.
The video volume is a bit low, so I think you try to turn it to max.
Oh, the video. Okay, give me a minute. Oh, sorry. Okay, I replay the video, yeah?
Got sound, but it's very, very soft.
Okay,
and let's do
is this better? Is this better?
I can hear you, but the audio one is
You play the video, let's hear the sound.
Okay, hold on a minute.
Okay, this is a fun exercise. You're not going to be able to see anything, so even though I'm squeezing my hand, what I'm really doing is working my pelvic floor. Now to work this muscle, you have to pretend like you're going to the bathroom and you're stopping the flow of urination. So right now what I want you to do is now contract the pelvic floor, stop the flow of urination, and then release it. And again, contract and release. Now this time I want you to think that you're on an elevator and you're contracting, and now you're going first floor, second floor, third floor, fourth floor. Hold it there, really contracting, at the same time releasing the hip flexors and releasing the buttocks, and now lower the elevator back down again. Remember what we're doing right now. Let's go up the elevator again. First floor, second floor, third floor, fourth floor. What we're doing right now is really going to help improve your sex life as well as prevent incontinence. So it's really important to practice these throughout the day. Lower it back down again. And now let's do our flutters. You ready? Let's contract, release, contract, release, contract. Now you can be doing this anytime and nobody knows you're doing them. So you can have a little bit of a thrill for yourself. So keep going, 4 and 3 and 2. Last one, hold it and release. Great job. Okay, now with that in mind, let's take it, continue kegling, and let's take it up into a bridge. So what I want you to do is peel your back off the floor, starting with your tailbone, elongating your spine, coming all the way up, keeping your belly in and your rib cage knitted closed. And what I want you to do is think, neck and chest, everything is relaxed and long. Bring those knees together, and now drop and pump. Drop and lift, and drop and squeeze the buttocks, and squeeze, and squeeze. Give me 4 more, and 3. If you want a little bit more intensity, let's bring that right leg off the floor and continue to drop and squeeze. Try to squeeze your knees together to get a little inner thigh work going. And up, down, up, down, up, down. 1 more. Let's switch sides. Bring it up, down. If this is too intense, just keep both legs on the floor and keep the motion going. It's up, down, 4 and 3 and 2, and last one, hold it and drop it down.
Okay, just a word of caution. If you are doing this at home, just make sure that you are on a firm and safe environment. Preferably, if you have a yoga mat, you can lie on top of the yoga mat. And if you have any back pain or say any big back injury, just do it within your ability. You can do the non-lifting leg one. So always remember, safety comes first, okay? Okay, now I'm going to show you the male version of this pelvic floor exercise. So hold on a minute.
Hello everyone, my name is Swan Hui. I'm a pelvic health physiotherapist from SGH. Many men with prostate diseases have an issue with urinary control. In this video, I'll be talking about how to do your pelvic floor muscle exercises correctly to help to control urinary leakage. Let's take a look at where the pelvic floor muscles are and how to move them with this animation created by the Continence Foundation of Australia.
The pelvic floor is the base of the group of muscles referred to as your core. These muscles are located in your pelvis and stretch like a hammock from the pubic bone at the front to the tailbone at the back and from side to side. They support the bladder and bowel and play an important role in bladder and bowel control and sexual function. If your pelvic floor muscles don't work well, you may leak when you do things like coughing, sneezing, lifting, laughing, or exercising. To stop this from happening, you need to switch on your pelvic floor muscles. To switch on the pelvic floor muscles, you need to squeeze and draw in the muscles around the base of the penis, as if you are trying to stop the flow of urine. You should see your penis draw in and your scrotum lift up. Breathe normally. Don't hold your breath or tighten your buttocks. Then let go and relax the pelvic floor muscles completely. Notice, as the pelvic floor muscle tightens, the anal passage closes. The same action happens to the urethra. By exercising the pelvic floor regularly, you will train your muscles to work automatically when they are needed.
Let's try moving the pelvic floor together. Choose a position where you can feel the movement the best. That could be lying on your side, sitting, or standing. Take this opportunity to get into the position of your choice. There are two main components to the male pelvic floor, the front and the back. We'll start with the front. To contract the pelvic floor muscles, pull the penis back into the body and then relax completely. What you should feel is as you contract the pelvic floor, the penis lifts slightly, and when you relax, it returns back to the original position. Take this opportunity to perform that a few times. Can you feel it? It's a small lift of the penis and the scrotum. The tummy muscles should stay relaxed, and you should be able to continue speaking if you need to. Now, let's include the rear part of the pelvic floor into the exercise by tightening around your anus like you're trying not to pass wind. Can you feel
Can't hear. Can speak louder, please.
Should remain relaxed. So, if you are seated, you shouldn't be
Can't
moving
hear.
up
Can
and
speak
down.
louder, please.
If you can't feel the movement well as you are trying,
Can you
try
try
another
increasing the volume of your video?
I
might be
did.
the easier.
I think your sound.
The right technique can take up to 2 weeks, so please be patient when you're trying. If you're using the wrong technique, the exercise will not result in any improvement. In fact, using wrong technique can result in worsening of the leakage. So it's important that you check that you are doing the pelvic floor muscle exercises correctly.
Can't see here.
You can
But you're
check
only
by
gonna on.
performing
No.
exercises in
You
front of
over.
the mirror.
Gone.
You should see that the penis and scrotum lift as you contract the pelvic floor and descend as you relax completely. Once you get the right technique, try contracting your pelvic floor several times throughout the day. For example, when you're waiting for the lift, when you're waiting for transport, or when you're queuing up for something. Start with a number of contractions that you can do with good technique for better results. Once you are able to do 10 pelvic floor muscle contractions comfortably with good technique, you can progress to a slightly more difficult exercise where you hold the pelvic floor muscle contraction. For example, if you're able to hold the pelvic floor muscle contraction for 3 seconds and repeat that for 5 times with good technique, You will practice that frequently throughout the day. Gradually increase the holding time to 10 seconds and increase the number of repetitions per set to 10. It might take you 3 months or more to get there. Take your time to increase the difficulty of the exercise with good technique. Remember to tighten your pelvic floor before you engage in activities that can cause leaks, such as before you get up into standing from a seated position and before you cough and sneeze. Typically, with 2 weeks of consistent exercise, you should start to feel some improvement with the urine leakage. It can take 3 to 6 months for the muscles to fully strengthen, so being consistent with the exercises is important. If you're experiencing difficulty controlling urine, ask your doctor for a referral to see a pelvic health physiotherapist. We can assess to see if you are performing the exercise with the right technique and design an exercise plan specifically for you for best results. Thank you for watching the video. I hope that you found the information helpful.
Okay. One minute. What is this? Okay, give me a minute, okay? Yeah. How do I? No, suddenly cannot. Give me a minute.
Okay, we are waiting for Ewan to share the slides again. For those who have not be able to hear the video that was shared earlier on, our colleague sister Irene has actually shared the YouTube link on the chat box. So you may click into the YouTube link and save it so you can watch it next time or later when the health talk ends. Alternatively, you can also look back at the Radima's pre-recorded health talk later, and you might review the videos again via their Facebook page.
Okay. Okay. Okay, my apologies for the video because I think the origin source for the video is a bit soft, but yeah, like Felicia mentioned, you can actually go to YouTube to actually see the video, watch the video again. So just a little recap on the pelvic floor muscle exercise. So this pelvic floor muscle exercise is actually particularly helpful for people who are actually suffering from stress incontinence. They can help to, they also can help to control other types of incontinence as well. But the key for this pelvic floor muscle exercise, right, is consistency. As it might take, severe months to even longer, right, to see the benefit of it. So you can actually do it anytime in the day, as mentioned in the video, while you're waiting for a lift, while you're watching TV, or while you're just lying on the bed. So let's move on to the next one. Okay, so drug therapy, right, can be prescribed to certain selective patient to reduce the urge incontinence. But of course, this will be have to assessed by the doctor to determine the suitability for the drug therapy. So in surgery, right, the doctors may recommend patients to go for surgery, right, for incontinence if, say, right, this patient cannot respond to medicine, exercise, bladder retraining, dietary changes, or even any other behavioral therapies. But the type of surgery, right, vary depending on the people and also the types of incontinence that the individual is experiencing. Okay, for those who are not medically fit for surgery and also suffering from a condition called uterus prolapse, right? In this case, a vaginal ring passerine can help. So as you can see from the picture, right, a passerine is actually a firm rubber ring that supports the bottom of your uterus to prevent it from prolapsing. So this one can be inserted by into your vagina by a doctor and can be wear continuously. So before I end my talk, here is some recap on how you should keep and maintain a healthy bladder. Always remember, it is important to drink enough water. A healthy person should try to drink at least 6 to 8 glasses of water each day. Plain water is the best fluid for bladder care. So at least half of our fluid intake should come from plain water. Some people need to drink less water due to their medical conditions such as kidney failure or heart disease. So always ask your doctor on advice on how much fluid you should drink per day. Limit fluid intake at certain hours. Say, example, before you are going out, so you try to reduce your water intakes. 2 to 3 hours before you go to bed, try not to drink a lot of water to prevent yourself from frequent urination at night. So always remember, choose the drink that does not irritate the bladder as shown in the picture with the tick. So those drinks, right, that can irritate your bladder, I would recommend you to cut down or take it occasionally for leisure, but surely not every day. Okay. Lastly, do remember to advise your loved one or your friends to stop smoking. Avoid constipation by eating plenty of high fiber foods like whole grain, vegetable, or fruits. Drinking enough water and staying physically active can help to prevent constipation as well. Keeping a healthy weight by choosing healthier food choices. Last but not least, do the correct exercise and do it regularly can help to prevent bladder problem as well as constipation. So I've reached
what sort of exercise? Sorry, can you go back again?
I will answer your question in a while.
Can you go back to the slide again because it's saying it.
Huh?
The previous slides.
This?
No. Why is it like that? Slanted.
Maybe I will answer your question in a while.
Yeah, but I need the slide to remember.
Is slanted meaning?
Okay.
Okay.
Okay. Thank you.
Okay, anyway, I reached the end of my health talk. So if you are interested in our health talk, our next upcoming health talk will be on the Mandarin version of urinary incontinence. So if you're interested, you can sign up for it also. So once again, I'm from SingHealth Community Nursing Program. So if you're interested in joining the program, you can actually call our hotline to inquiry or actually email us at community.nurse@sgh.com.sg. So we will respond to you through the email. So we come to the Q&A. So I think a lot of you might have a lot of questions. So feel free to ask me.
Nurse, so sorry to disturb, because last minute there was a call, so I missed maybe the first 5 or first 3 slides. Can go back now.
Don't worry if you have missed the first few slides, right? It will actually be shown in the Redima's Facebook page. So you can go there to see. After this, there will be you can watch a repeat the repeat session in the Redima's Facebook.
Thank you.
Yes, anyone have question?
I have question.
Yes.
If you say the night time when you sleep, you have cold feet, does it cause make you more frequent go toilet?
Actually, like for elderly, right? Especially when it comes to cold weather, right? It tends to frequent urination, but you have to depend. If you experience frequent urination due to cold weather, right? And other than that, usually normally you don't experience it, right? So it's actually an external factor. So if it can be prevented, right? So you will either increase the temperature in your room to make yourself warmer, or try to drink less water before you go to bed. Yeah. Anyone else?
If you drink less water but still go toilet very often, what's the reason?
Yes, so this one, right, you will need to take note. So example, if you are saying, one day I only say maybe drink 500 ml of water, but at every 1 hour, I will need to go to toilet. So this one could be a symptoms that you might be having urinary incontinence. So it's best that you note down. And then when you feel that it's getting more serious than before, go and see a doctor. So the doctor can actually help you to determine and assess if you are actually suffering from urinary incontinence, or are you having any kind of infection that actually causing it to happen? That's a good question.
I have a question just now. While you showed all the male exercise, those are only for male, not for women.
Previously, the first video I showed is for ladies one.
Yeah, earlier. That's why I missed some of them. But later, male, indicated male means ladies cannot do.
Yes, because we have different organs. So female will have their own sets of exercise. Male will have their own sets. But if you missed out the first video, you will go back to watch the replay version in the Redima's Facebook, okay?
Thank you.
Okay.
Just add a bit. Yeah, I'm Irene, the sister Irene. Hi. I think you all will be, and I'm sure you all enjoyed the talk, right? It's very interesting, isn't it?
May I ask a question?
It's very helpful.
Can I just answer to the just now the male and female video? So all of us have pelvic floor, right? So the thing is that our organs are different. So if let's say the one that it demonstrate the pelvic floor, that one is still correct for both. But of course, we don't have, for female, we don't have scrotum, penis, that kind of thing, right? So it's better that we see the female one and we can try using the female exercise. But the principle is to stop the flow of urine. So if you want to check which muscle is the correct one, is the one that stop the flow of urine. That is the correct muscle. So yeah, we advise you to see the video for female and the video for male is for male.
Hi, may I ask what are the symptoms of a urinary infection? Any telling sensation or anything that can help the elderly?
Yes, so if you are suffering from infection, you will feel painful when you try to go toilet to pass urine. Some of them might see blood-stained urine. You might be having fever, and you might have actually more urine, more episode of going to the toilet compared to when you are not having an infection.
I see. Thank you.
Hello, may I ask you? Hello?
Yes.
Coffee will cause a lot of urinary.
Food like drinks like coffee, yes, it will irritate your bowel, your bladder, sorry. So sometimes yes, in certain people it cause increase the urine volume in your bladder. So that's the reason why you will be advisable to cut down on caffeine product.
Including chocolate?
Yes, you're right. Chocolate, yes.
Thank you.
Need to cut down.
But you see some people,
coffee, all this. What other diuretics are there?
Sorry?
What other besides chocolates, tea and coffee, caffeine? Are there others to take note?
Yes, like I mentioned, with alcohol, carbonated drinks, so sparkling water, chocolate, those food with high spice one. Yeah, all these are actually the type of food that will actually irritate the bowel.
Bowel or urinary?
Sorry, bladder. Bladder. Okay.
Thank you.
So sorry.
Okay.
May I just add? Hello. I think you check yourself. Okay. Sometimes different people have different reactions. So you may want to just test. If let's say sometimes also depends on the coffee, whether it's very thick or very diluted. Some people may not have any much effect on them. So probably you just test and see. If let's say it really affects you very much, then you know yeah, that this one is will affect you, and you pass urine a lot after you take that or you drink that drink. Okay.
There's one just to check. There are people who say like middle of the night, when you get up, then you drink some water, right? So it's better to do it before you urinate or after you pass urine.
For this actually also depends on individual lah. But for certain elderly, right, usually I will advise if you feel like going to the toilet to urinate, you urinate first, then you drink water. But if you have the habit, say in the middle of the night, you will wake up to drink water, right? You try to take either sips or less than like half a cup, just to moisture yourself and your throat. Yeah, try not to drink like one whole cup.
Actually sip lah, just sip, not less than half, but just to sip and you keep
to moisture your throat. Correct.
Good for blood circulation, right?
Yes, warm water is good, especially in the middle of the night, right? Try not to drink cold water or those in room temperature, like slightly colder one. Warm water, go for warm water is good.
Okay. So before, after, no, doesn't matter lah.
Hello.
Before, after passing urine is no, that doesn't make any difference.
Oh, sorry.
Yeah,
taking the water before, after passing urine.
Because say if you wake up in the middle of the night to urinate, right? Then if you actually stand and drink, some people will feel very urgent, and then that's the reason why they will experience leakage. So usually I will advise you try to clear the urine first, then you drink water. But yeah.
Can I check with you? I have seen a Japanese video. They are doing a survey on the elderly passing urine more often than a young one, because when they are doing it, like I can feel it that when they drink more water in the day, elderly I mean, but they pass urine is less than the young persons. But when come to the night time, they don't drink so much, but the pass urine is more. They have measured, they have do the measurements. So whether is it that this is the right, is it that this is a true things that elderly that will pass urine more than the daytime?
Yeah, actually mentioning, is it at night in particular?
Yeah.
Okay.
But
so
they drink less, but the measurement is night time they will discharge a lot.
Okay.
But daytime they discharge less.
Okay, for night, right, there are many environmental factors that might contribute. So as mentioned earlier on, temperature might be one of it. So elderly, right, their bladder, usually some of them are more sensitive to cold environment. So they actually tends to stimulate more urine in the middle of the night. Say if you have underlying chronic disease such as diabetes also, right, it actually also will, because of the nerve damage, right, some people, right, they will actually also stimulate the nerve signal in your bladder to create more urine also. Yes, so that's why, okay, if say your normal routine is every night you will wake up 2-3 times to pass urine, right? But in the day, right, you actually maybe say also 2-3 times is your normal, right? Usually doctor of course will not directly say you may be having incontinence. That's why they will actually find out whether or not you have any environmental factor that's causing it, or you have underlying medical condition. But it's true that elderly do wake up more often in the middle of the night to pass urine than younger people. Yes.
So like just now you mentioned about this, they didn't completely discharge during the day. Is it daytime that they can you will keep it in the bladder? Those urine will keep it for the night time to discharge?
Sorry, answer. Not really lah. Because if let's say you find that your bladder is full, then yes. But our bladder usually it will trigger us to pass urine roughly around 250, that kind of thing. But if let's say the nighttime pass urine one, usually that is produced more for nighttime to pass urine. Yeah, but unless some certain people like prostate problem, then they never completely empty their bladder. Means that their bladder they empty maybe 50 mils, 100 mils, but inside still got maybe another 100 mils, 200 mils. Then when the kidney produce more urine, then put into the bladder, then the bladder feel full, then you still want to go and pass urine. And especially when you're not doing anything at night, then you feel that, hey, my bladder is always full, then you always want to go to a toilet to pass urine. Yeah. So also certain things like daytime you got other activity, then you may not be concentrating on your bladder full, that kind of thing also. Yeah, so a lot of factors may contribute to it. And also male may have prostate issue or never pass motion enough, so that's why you retain the urine, so there's a lot of reasons and conditions that you may need to slowly rule out lah.
So is it because of the positions? Because nighttime when we lie down flat, is it because of pressing on this bowel or things like that cause you?
When you lie down flat, actually you are not pressing so much on your yeah. You're actually sitting down, I think will press more on your bladder. Yeah. So it's not really the lying down position that will trigger you to go and pass urine. Yeah.
Excuse me, one question is it that if you don't clear your bladder, once you pass it will cause urinary tract infection?
Yes. So what happens is that
the reasons, because you didn't clear, then the urine will be
accumulate. Yes. Accumulate inside your bladder. So what happens is that there's germs inside, right? So the germs will accumulate, right? So the germs they multiply in they
contaminated
to the power of 2, So if let's say they split into 2, then after that become 4. Then after that they have times 4, so it's 16. Then 16 times 16 is how much? 32. 32 times 32 is how much? 125, right? Or something. So after that, it will be billions and billions in your bladder. So if let's say you never empty properly, completely, then there will be so much bacteria inside. Then that is urine infection. And urine infection, if not treated, it will go into the blood. So then you will get fever. So yes, what you say is true. If you don't empty your bladder regularly, completely, you're more prone to having urine infection.
Thank you, Sister Irene and Ewan, for the sharing.
Thank you. Yes, confirm.
May I ask a question? But if you were to clear your urine completely, especially in the morning when there's a lot of urine, but you add stress onto that, then you have burning sensation.
The burning sensation, it may be an indication that you're having urine infection actually.
It's no, but I checked with a doctor, they say that you don't completely force out all the urine. So otherwise it's stress there, Is it true?
Should not be forcing. I don't think you just clear, wait for a while, relax.
Yeah, you let it flow out naturally. You don't need to stress it. If you want, then just now what Ewan has taught you, all right, the double voiding. Double voiding is, you lean forward just now, what the 5 steps, remember, in the slides. Maybe Ewan can go back to the slide.
Can show again, that slide. Yeah.
Can share. Okay, so this is can you see it? You lean forward, then after that you let the urine pass. Then after that you find that it's empty already, then you wait for 20-30 seconds. And then after that you try and pass again by leaning forward again, Like that, if you find that it's not complete in your emptying, you can try this method lah.
So what about constipation? If the person, is it normal person constipate for a couple of days or 3 days?
Some people, it's their habit to pass every 2-3 days. So if we cannot say that every individual must pass every day. Yeah, but of course, ideal will be you are able to pass motion every day lah. Yeah, but if let's say this is your normal habit, it may not be a constipation. But if let's say a person who pass daily, then you never pass motion for 2-3 days, then you pass out, it's very hard motion. That one is probably constipation lah. So you have to, make sure that you empty the bowel, then you see how you can pass urine or not. I'm sure every one of us ever experienced before. After constipation, once your stool has been passed out, your urine also will pass out naturally, isn't it? I think it's a natural thing. So you have to empty your bowel lah, in order for the urine to pass out clear lah. Yeah.
But the problem is like, you see, the stool is already at the anus, the rectum side, but just cannot come out. So when you force, it's no good. But how? It's very soft. Just in between there, cannot come out. How? What to do? Massage. I know we say massage clockwise. That sometimes help. And then I also learn one method
there are some people who may need help by those squatting stool, that now our toilet is not the squatting type, right? So our toilet is the sitting type. So some people, they have this, you can buy those where you can put your leg higher. When your leg is higher, sometimes it's like squatting like that. Some people may find it easier to pass motion like that.
Oh, okay. Not bending that just now about the urine.
You can also try bending if you don't have that step. You can also try that. Yeah.
Okay.
Some people find easier to pass motion like that lah. Because I think last time we used to squat lah. Remember? Yeah, those olden type of toilet.
May I share something?
Yeah. Okay, to lift up 2 legs and then force a bit lah.
You may want to try the squatting toilet, but of course you squat too long, you may have difficulty standing up, so you need to be careful.
Yeah.
Hi. I think bananas good for it.
Papaya, fruits.
Yeah,
papaya.
eat more fruits may help lah.
Yeah, too much fiber also can cause constipation.
That's why you have to balance with fluid, with water.
And for that lady just now, when she said it's like stuck in the anus, right? Can't come out. There is one thing she may want to try, like take the toilet paper, fold it, then put it against the surrounding of the anus, the hole there, and try to gently exert a little bit of pressure, press. Then slowly it can come up, but cannot press too hard.
So you mean
it could be very hard stools at the opening of the anus. But once the very hard one comes out, the rest will be easier to come out. Okay? Because when you're already seated on the toilet bowl, right? And it's already like coming out, not coming out, then there is a worry that, oh dear, what if I do that, then suddenly, become very messy on the floor.
Can I repeat what you said? Means roll the toilet paper harder, and then
no. Okay, I repeat. Okay, you can fold, in order not to use your hand to touch. Okay, you can use your toilet paper, fold a few pieces so that you don't have the contact with the feces, the poo. Yeah, so you just use your fingers slowly around the opening, the anus opening, and just try to depress, press surrounding the anus, slowly, gently going round. Then it can come out bit by bit lah.
Oh, that means like soften the
Once the
stool
very
lah.
hard one opening and the opening comes out, the rest usually will come out more easily.
So it's like softening the feces ah.
You're correct. Very clever. That's very good. Yeah, what you say is right. It's actually applying the pressure. Okay, around the muscle that the perineal, perineal region lah. We call it the perineal region. Okay, so when you press in, the stool will come out lah. Yeah, that's correct. If you're constipated and your stool is in between, then like can come out, cannot come out, that kind of thing. You can actually apply the pressure to the side of your anus lah. So as you press in, the feces will come out. Thank you. Yeah, very good.
Yeah. Hi, if you don't mind, I share. I think the food, if we take heaty food so much, it will cause it.
It may lah.
Hello.
Balance with water lah.
Because younger days, no problem.
Yes,
SGH, this problem. Younger days, every day, no problem. But SGH, wow, this is a problem, I tell you.
Yeah, because of habit.
I don't know what's the cause, but somehow.
It's try to have a good habit, lor. I think we never develop good habit. Try to like pass motion at a certain time each day, regularly, for example, after breakfast or something. So developing a habit will help you to pass better. And also the food that you eat, enough water, enough fiber, reduce the food, reduce liquid that will always cause you to pass urine more. And when you pass urine more means the water is being absorbed through the gut. So your feces will be drier. Yeah. So good habit lah.
May I share?
Last question, okay? Because I think Felicia is telling us that it's already way over time.
Okay. And then I ask my question. Because I was going to say about TCM, how it helps. That one, but I asked a question that concerns urination. A person urines and pass out. Then before then she cleans up and getting ready to go, but then there is another urge to want to do it. Is this incontinence?
This is not incontinence. This is incomplete emptying of the bladder. So please continue to wait for it to pass out. Means that there's still urine inside your bladder.
Oh, because it was as if it's all done, but then after cleaning up, the person still wants to go again.
Yes, then you can wait a while more. Yeah, because as you grow older, the muscle there is a bit more, not so well controlled lah. It's like the pipe, the tap lah. You turn on, turn off. Sometimes it's not completely turned on to let it flow completely. So it's halfway like that. So it's not complete. It's slow flow. Then after that, it's never completely empty. And then inside the bladder also, some may have pockets there that, as you change position also, you may actually want to flow out. So that's why as we grow older, we have this type of problem lah.
I see. Okay, so I just want to make sure that it's not incontinence for the person. Yeah.
No, incontinence is passing urine at the time that is not in the toilet.
Yeah, okay.
Okay, thank you very much for all the questions.
Nurse,
sorry,
the cleaning process, what is the correct procedure to clean after you move your release your motion?
Clean, okay. For proper hygiene, you wash will be better. But when you wipe from the vagina first, go to the back lah. The cleaner part to the dirtier part lah. So that the dirtier part won't have the bacteria go up to the urine part lah. That's what we advise.
Okay, thanks.
Sorry,
okay, thank you.
The shortage of time, right? We already actually have overrun. So actually, I know you all have a lot of questions keen to learn, right? Don't worry. For SGH, they have a Ask Missy session. You all can sign up for the Ask Missy and ask any question pertinent to what you all want to know. Felicia, would you like to share that?
Yes, I will actually share the link inside. It's actually together with the Radima's Health Talk sign up link. So you can actually scroll to the bottom and input your interest for Ask Missy. Just to let you know, for what Ask Missy is actually a one-time off service for those who are not in our community nursing program, whereby if you have any general question like what is being asked during the health talk, you may actually we can actually call you and make an appointment with you for a 30-minute short session for a one-time off. So, but do note that if you have any personal health condition that you would like us to share, we might not be answer you on that due to PDPA issues. But however, if you have any general questions you would like to check in with us, do sign up for that, and I have shared the link in the chat box already. And I believe there's one question at the chat box earlier on regarding how often should one urinate. I'm not sure if the question has been answered during in the group chat earlier on. Even do you manage to answer that question?
So I don't think we have answered that question. Oh, okay.
Yeah.
So the interval of how between urine to urine actually depends on individual also, and how much water you drink. Of course, the more water you drink, the frequency of going to the toilet is more frequent. So the lesser water you drink, the frequency of going to the toilet is lesser. So it depends on you. If you are someone who always go to toilets every 3 hours, so is your normal regime, then is considered normal. What we are talking about in abnormal is, for example, right, the same amount of water that you drink, but however, right, just particularly speak, you are going to toilet like every 1 hour to 1.5 hours constantly, and then that's where you might worry that this is not your normal regime. Yes. So it's there's no definite answer on how many hours should there be the interval between urine and urination. Yeah.
Hi. May I ask if anxious also can cause it go to release more often?
Okay. Yes.
This will be the last question that we will take it.
People who feel anxious, yes, will tend to have I think this is mood related lah. So like when I feel nervous, yes, I will feel like I want to go toilet more. So this is actually mood related, but definitely it is not incontinence lah, because I think most of us will feel this way, especially if we feel very nervous about something. Like example, we're going to do a blood test or injection. We feel nervous and we feel like going to the toilet often, right? Yeah, it is normal. It's part of the mood related contribution. Yeah.
Thank you very much.
Okay. Okay, thank you everyone once again for your time.
Thank you.
Yes.
Thank
so
you.
if you are
Thank you for your time.
next week.
Okay.
So
if you're interested, so you're interested in the Chinese version, Mandarin version of this urinary incontinence, can join us for the next week talk also.
Okay.
Okay, Ken. Thank you so much.
Thank you.
Bye-bye. You need to register for the Mandarin talk.
It will be great if you can actually register with us. So like it's the same as the link that I shared earlier in the chat box. Will you be able to see it?
You don't please don't mind. I ask just now before the talk started. I asked like I sign up, I don't receive the link. Then I heard a sound say that will call me later. Is it?
Yes, Miss Christina, we will call you shortly again to see how can we rectify this issue. Because we realize that you have not been receiving our invitation on a weekly basis as well. No worries about that. I'll call you shortly. Will that be okay?
Okay, thank you very much.
No problem. So for those who wish to sign up or new to us, you can sign in via the link I sent you. So we will update our health talk on a monthly basis, and you will be able to see what are our upcoming talks, and like what Gary as well what David has shared earlier on. For those who are keen on our Ask Missy session, you can also sign yourself up via the link shared in the chat box. So once again, thank you, Ewan and Sister Irene, for the sharing and everyone's contribution and sharing on their personal experience as well. So for our friends who are celebrating Diwali, happy Diwali in advance to all of you. So stay safe and thank you. Bye.